Good morning, everybody. Thank you for heeding our advice. We had testing numbers over 8,100 again yesterday, but we did have 6 additional cases, half of which are from a known source and half of which we understand at this stage could be from community to community transmission. This again states how vigilant all of us need to be, especially from Friday when restrictions are eased, and it's really, really important for all of us to take that extra precaution, as we know there will be many more people out and about, and many more people out and about for recreation as opposed to other reasons. That is a big shift in the way in which we're managing the pandemic, a big shift in the way in which people can have that extra bit of freedom. Whilst we welcome that and are grateful that we're at this stage to be able to do that, those high rates of testing will ensure we can protect the community as much as possible and make sure we can also focus on those parts of the community where we really want to open up business and get those jobs going. We need to be in a position to do that, and therefore it's so important for all of us to come forward and get tested even if we have the mildest symptoms. And I was very pleased to have brought to my attention a number of international reports which have said that New South Wales has the highest rate of testing in the world. It's something we're incredibly proud of, something we need to maintain. And I always say to our experts and my team here in New South Wales that there's no reason why we can't also lead the world in the way that we deal with the pandemic moving forward, in the way in which we give the good advice to our citizens which keeps us all safe, but also look at parts of our community, parts of business in particular, that we can activate without having any adverse impacts on health. We know, though, that from Friday we'll be analysing the data very closely, because we appreciate once you ease any restriction, there's more activity, there's more chance of people getting the virus or passing it on to others. And we also know, given how good the return of schools has been to date, I know it's only day 3, but the feedback we've had so far has been very positive, and we anticipate that after next week there is a strong chance that the vast majority of students will be back to face-to-face full-time learning, but that is something the Education Minister and I will update everybody on next week. It is really important for us, again, to maintain that vigilance, to come forward and get tested. But meanwhile, whilst the restrictions were in place, I was able to advise the community that we were making sure that we were increasing our capacity in the health system. And I'm very pleased to announce today, and the Health Minister will outline in greater detail, but we've invested millions of dollars to refresh the skills of 1,500 nurses so that they can have intensive care training. So in addition to our intensive care nurse workforce, we now have an additional 1,500 nurses from around the state that have been given a refresher course to make sure that if we need to call upon them, they are willing and able to assist us in dealing with those intensive care patients. At the moment, the number of people in intensive care, especially with COVID, is very low. And of course, that's what we'd like to keep it. But we know that's not going to be the case. Once we ease restrictions, it definitely won't be the case. But if you look around the world, many communities who are easing restrictions aren't in the position New South Wales is in. Many communities around the world who are easing restrictions still have case numbers in the hundreds every day, which would have been untenable for us, because that would have meant thousands of people would have been in ICUs. It would have been an untenable situation. So we should we should feel very fortunate that we're in a position, as we're easing restrictions, to have the case numbers where there are. It does give us more options, but it also means we have to maintain our vigilance. We have to get tested if we have the milder symptoms. We have to stay home if we're worried we've been in contact with somebody, and we need to take every precaution. And I can't stress enough that when you're with people you know very well, even if you're outdoors, you tend to forget sometimes. You tend to forget you have to socially distance. We can't let that happen. Even if you're people who are very familiar to you, inside the household it's fine, but outside your own household, outside with the people you live with, even if they're members of your extended family or they're very close friends, don't think that you can't pass the virus to each other. Please be careful. The last thing any of us want is to either contract or give the virus to those that are closest to us. But again, thank you to New South Wales for really being on the journey together. It's because of the goodwill of the community that we've all been able to get this great result. But again, our success won't be measured by the number of cases we get every day. Our success will be measured equally by how many people keep their jobs, by how many people don't feel that stress and experience that diminishing quality of life that so many have in the past few weeks. And we certainly want to focus on people having job security and people having that good quality of life moving forward, and that's what easing the restrictions is all about. I'll ask Dr Chant now to give some more detail about the medical report overnight, and then the Minister for Health will provide further detail on our announcement about retraining those great nurses for ICU.
Nurses like myself, who are used to being in an operating theatre, the idea of being thrown into the ICU as the COVID crisis escalated was quite daunting. So having that training to prepare us in the event that we did need to go in there was vital, so that we could manage those patients well. It gives us new skills and new knowledge that we wouldn't have otherwise had, and it relieves some of those fears and anxieties about the potential for being put into an ICU, having to look after a ventilated patient who's critically unwell. I think it's been fantastic in the sense that we now have a greater rapport between the two departments, between the ICU and the operating theatres. So we were going over there to train their staff in the use of some of our equipment, and they were accepting our staff into their environment to learn about their equipment. So suddenly there's new relationships being formed in terms of being able to know each other a bit more, and also just being able to work together better, to have that understanding of what's needed for the patient who is going to ICU after operating theatres gives us more resources and tools to know what they're expecting from us as well. Absolutely. Our staff, the 15 that were sent over for training, now have a better understanding of ventilation that they can use in the operating theatres. And hopefully their staff also have a better understanding of what we do with anaesthetics. I think it's been a wonderful team approach to preparing for COVID. It's built capacity for the ICU to have more staff in the event that we do go into a COVID crisis. So patients will be able to come in and have skilled nurses who have an understanding of ICU in the event that this crisis escalates again. So I think that's really valuable, that patients who are coming into the hospital have that confidence that that staff who are coming into ICU are trained, they're skilled to be able to do their job properly. My perspective on nursing has changed since the pandemic arrived. I think there's been a real specialisation that's happened within the nursing profession. But when we see this sort of crisis emerge, it becomes very apparent that we need to be able to function in other areas that we're not usually working in. So it's meant that our operating theatre staff need to be ready to go into other areas like ICU, for example. And we've seen a lot of that where staff have been put into other environments where they wouldn't normally work. So it means, I think, we've got to be prepared as nurses to be able to go into those other departments to function in our roles. Very appreciative and grateful for that opportunity to gain extra skills, to see nursing from a different perspective, but also to bring those skills back to our normal environment and incorporate them into what we normally do. I've been really impressed with the way senior management and educators from both ICU and operating theatres have worked together and put in a lot of effort to prepare for this crisis and to bring a lot of change quickly so that we can manage patients in this current situation. I think as a nurse, we're always looking for opportunities to grow, to gain new skills, and to broaden our knowledge, not just of what we do in our own department, but of what goes on around the hospital, so that we can better manage our patients and give them the best possible care that they need.
There are many plans in place to rapidly escalate the number of critically ill patients we can look after. Yes, we're going to get through it. I think there's going to be some changes afoot, and we'll get through it together, I hope.
The first thing you're going to do is actually turn on the 100% oxygen. So see where it says oxygen suction? Now
Yeah.
that's on.
So I'll hit it again and
Yep. Just confirm.
turn the knob.
Yeah, let's just turn it off as well.
Okay.
That's it. Perfect. That'll be about it. Yep. And you'll keep going down until you can't go any further. Okay, now come back about it.
Okay.
And then just maybe, yeah, look, that minute volume can probably go down a little bit. What do you think?
Yeah.
With your ventilation mode, just need to go in and make sure that you're on the right mode.
Right. Where are we here?
We're adjusting them every time they breathe.
Ah, right,
as well.
okay.
So if you went to pressure controlled ventilation,
Yep.
that's it. Pressure that determines when the patient finishes their inhalation and starts exhaling.
Right, okay.
Does that make
So that's
sense?
the highest
Yeah.
pressure.
Yeah. So we tend to use that ventilation more so for patients who've got really stiff lungs.
Okay. Patients
Yes, yes, that sort of thing. ARDS potentially.
Okay.
Patients who may have ARDS. Anything
Would-
you've got that increased pressure,
Yep.
you've got those,
All the fluid and all that.
yeah, the cut glass look on the X-ray, that sort of thing.
Okay.
So,
Does it rectify?
We've spent a lot of time over the last 6 weeks or so in ensuring that we have nursing staff available to work in our intensive care units. We've used the time available to us to identify nurses who are working in critical care areas who may or may not have previous intensive care experience, and we put them alongside our intensive care nurses and are reskilling them so that they're able to look after patients should they be required. Our intensive care units are highly specialised areas. All of us know that if you're in intensive care, you're requiring very, very highly skilled care and close monitoring. Nurses need to be there 24 hours a day, observing, providing care, highly specialised care that involves drug therapy, airway management and whole of body system observation and care. So the local health districts have sent out the call to our nurses to identify nurses who've had recent intensive care skills, may have just recently left the intensive care environment, or have been out working in other areas for a number of years. To date, just over 1,500 nurses have commenced upskilling in our intensive care units. It's a huge commitment